In the early days of the COVID-19 pandemic, the world came to a standstill. Lockdowns, isolation, and the uncertainty of the virus itself became the new normal for billions of people around the globe. Hospitals were overwhelmed, economies were shaken, and daily life was disrupted in ways no one had imagined. But as the world slowly recovered and moved into the post-pandemic era, we began to uncover a new set of challenges, health issues that were either caused or exacerbated by the pandemic, some of which are only now being fully understood in 2024. COVID-19 left behind more than just physical scars. It left an indelible mark on our bodies and minds that many continue to struggle with today. As we transition from the crisis of the pandemic into what should be a recovery phase, it's clear that the impact of COVID-19 on global health is not something we can easily shake off. In fact, the health challenges we face in 2024 are a direct result of what happened in the wake of the pandemic. The question now is, how do we overcome these lingering effects and build a healthier future as we head into 2025? One of the most significant health issues that emerged from the pandemic is what's now widely known as long COVID. While many people recover from the acute phase of the virus, there is a substantial portion of the population that continues to experience debilitating symptoms long after their initial infection. In 2024, research has confirmed that 1 in 10 COVID survivors suffer from long-term effects, which range from fatigue and brain fog to heart palpitations, joint pain, and even organ damage. Long COVID is not a singular condition, but a collection of symptoms that can affect multiple systems in the body, including the cardiovascular, respiratory, and neurological systems. In fact, new data has shown that nearly 200 symptoms are now linked to long COVID, which makes it a particularly complex condition to manage. What's especially troubling is that the understanding of these symptoms has evolved over time. While many initially thought of long COVID as just a lingering cough or fatigue, we now know it can manifest in ways that are far more complex and persistent. Doctors are beginning to see that long COVID is not just about the virus itself, but how the body responds to it, potentially triggering immune responses and inflammation that can last for months or even years. This has led to a shift in how medical professionals approach recovery, focusing on individualized long-term care for patients who still struggle with symptoms long after their initial diagnosis. But COVID-19 didn't only affect the body, it also had a profound impact on mental health. The pandemic era was marked by unprecedented levels of stress, anxiety, and fear. The isolation caused by lockdowns, the sudden changes in daily routines, and the constant worry about the virus itself contributed to a dramatic rise in mental health disorders worldwide. As we moved into 2024, the mental health crisis has only deepened. Research shows that depression and anxiety have skyrocketed, with millions of people struggling with the psychological fallout of the pandemic. What's worse is that these issues are not just temporary, they have become chronic conditions for many, which means we are now seeing a mental health epidemic that will likely last for decades. In fact, depression has become the leading cause of disability worldwide, according to the World Health Organization. The emotional toll of the pandemic is something we're only just beginning to understand. The stress of isolation, financial instability, and the fear of losing loved ones has left an emotional scar on nearly every person who lived through those uncertain years. More concerning, however, is the growing number of young people who are reporting mental health struggles. Mental health surveys conducted in 2024 show that over 60% of individuals under the age of 40 now report significant stress, anxiety, and depression, a sharp increase compared to pre-pandemic years. The pandemic's toll on mental health is likely to be felt for many more years as society continues to cope with the psychological after effects. Beyond mental and physical health, the pandemic also exacerbated existing chronic health conditions such as obesity, diabetes, and cardiovascular diseases. Before COVID-19, conditions like heart disease and obesity were already top public health concerns. However, during the pandemic, many individuals faced significant disruptions in their routines. Gym closures, lack of access to regular health care, and increased sedentary lifestyles due to lockdowns resulted in people gaining weight, developing unhealthy eating habits, and abandoning exercise routines. Even as society returned to some semblance of normal, the damage to people's physical health continued to grow. By 2024, 40% of the population is classified as overweight or obese, leading to an increase in related health conditions such as hypertension, type 2 diabetes, and stroke. One of the most alarming trends in 2024 is the increase in cardiovascular disease linked to both the pandemic and COVID itself. Studies have shown that people who contracted the virus are at an increased risk of developing long-term heart problems such as myocarditis, arrhythmias, and even heart failure. This is especially concerning because heart disease was already one of the leading causes of death globally before the pandemic. And now we face the double threat of an aging population and the lingering effects of COVID-related heart damage. The question is, how do we fight back against these growing health risks in 2025? The good news is that overcoming these health challenges is not only possible, it's already happening. Experts and medical professionals worldwide are working tirelessly to develop solutions to help individuals recover from long COVID, address mental health issues, and combat the rise of chronic diseases in post-pandemic society. In 2024, we are seeing significant progress in several areas, and there is hope for a healthier future in 2025. For those struggling with long COVID, personalized treatments are becoming more common. Physicians are beginning to tailor recovery plans that focus on strengthening the body's immune system, improving lung function, and reducing inflammation. Research is showing that things like breathing exercises, physical therapy, and immune system support are helping many long COVID sufferers regain their energy and reduce symptoms. While long COVID may not be fully understood, medical advancements in 2024 are giving hope to those still battling its effects. Mental health recovery is also receiving significant attention. In 2024, new digital therapy platforms and AI-based mental health tools are gaining popularity. These innovations allow individuals to receive therapy from the comfort of their homes, helping to reduce the stigma around seeking help and increasing access to support. Additionally, wellness practices like mindfulness, meditation, and yoga are becoming part of the mainstream approach to managing stress and anxiety. People are learning how to take control of their mental health and develop more effective coping strategies. The fight against chronic physical conditions is also gaining traction. Health experts are pushing for a shift toward healthier lifestyles, focusing on nutrition, exercise, and preventative care. In 2024, there is a growing movement toward plant-based diets, low-carb options, and whole food eating to help manage weight and reduce the risk of chronic diseases. Even small changes such as incorporating 30 minutes of exercise per day have been shown to significantly improve overall health and help prevent conditions like heart disease and diabetes. As we look ahead to 2025, it's clear that the pandemic has taught us invaluable lessons about health, both physical and mental. The challenges we've faced over the past few years have exposed our vulnerabilities, but they've also revealed the incredible resilience of the human spirit. For many, 2024 has been a year of recovery, reflection, and learning, but the journey is far from over. The lessons we've learned are not just about surviving adversity, they are about embracing a new way of living, a healthier, more balanced future. One of the most profound lessons is the importance of self-care. For so long, many of us prioritized work, social obligations, and external pressures over our well-being. The pandemic forced us to slow down, reflect, and realize that our health should always come first. As we move into 2025, it's essential that we continue this mindset. Taking care of your body, mind, and spirit isn't just about avoiding illness. It's about building a foundation of strength and resilience that will help you thrive no matter what challenges arise. Whether it's committing to a daily exercise routine, prioritizing mental health through therapy or mindfulness, or making healthier food choices, every small step counts. Another lesson we've learned is the power of adaptability. In the face of uncertainty, many people discovered new ways to work, socialize, and take care of themselves. Remote work, virtual therapy, and home fitness became part of our lives, and while it wasn't always easy, it showed us how flexible we can be when necessary. As we step into 2025, remember that adaptability is key. The world is always changing, and being able to adjust and adapt to new circumstances will make you more resilient. Whether it's embracing new technology or adopting healthier lifestyle choices, adaptability is what will keep you ahead. Perhaps one of the most important takeaways from the past few years is the need for community and connection. The isolation of the pandemic highlighted the profound impact of human interaction on our well-being. While technology allowed us to stay connected in new ways, nothing compares to the power of in-person relationships and support networks. As we move into 2025, don't underestimate the importance of building and nurturing relationships. Reach out to others, whether it's family, friends, or your local community. Social support plays a pivotal role in mental and physical health, and having a strong network of people around you will help you navigate the challenges ahead. Finally, we must recognize the importance of prevention. The pandemic reminded us how fragile life can be and how critical it is to take care of our health before things go wrong. It's not enough to wait until we're sick or struggling. We must take proactive steps now, whether it's staying on top of regular health checkups, adopting healthier habits, or managing stress before it spirals out of control. Prevention is always better than cure, and the steps we take today will set the tone for a healthier, more fulfilling tomorrow. To fight fatigue and increase energy levels in 2027, it's essential to focus on three key areas: nutrition, exercise, and rest. I say eating a balanced diet rich in whole foods, including fruits, vegetables, lean proteins, and healthy fats, provides the body with sustained energy throughout the day. Regular physical activity, especially cardiovascular exercises, boosts circulation and enhances stamina, making it easier to stay energized. Additionally, never underestimate the power of good sleep. Prioritizing 7 to 8 hours of restful sleep each night allows your body to recharge and operate at its best. By combining these strategies, you can naturally increase your energy levels and maintain consistent vitality in the year ahead. In closing, 2024 has been a year of reckoning, but it's also been a year of growth. We've faced immense challenges, but we've learned that with determination, adaptability, and a focus on health, we can rise above them. The year ahead, 25, offers a fresh start, a chance to take what we've learned and create the best version of ourselves. So as we step into the new year, remember these lessons: prioritize your health, be adaptable, foster meaningful connections, and embrace prevention. Your future starts now, and the best is yet to come. Let's make 2025 the year we truly thrive.